Hello guys, and welcome back to my channel Malik Helps. So in this video we are going to talk about psoriasis, eczema, erysipelas, Parkinson's disease, phenylketonuria, gout and gouty diathesis. So let's start. So let's see what is psoriasis. So psoriasis basically is a chronic autoimmune condition which can cause rapid skin cell turnover, leading to scaling, inflammation and red patches, skin covered with the thick silvery white scales, most common in the scalp, elbows, knees and lower back. So we are going to use these silvery scales in the KROK question very well. So let's see the features. Features are itching, soreness, raised red patches with silvery white coating, also known as plaques, and the pitted nails and joint involvement. So let's see the triad of psoriasis. This is the most important thing. If you remember this one, so you are going to solve all of the KROK question very easily. So first is candle wax sign, which means that easy peeling of the skin. Next is auspicious sign, which means there is a further scarping, and after the scarping we are going to see the bleeding in the area. So if we scarp off those silvery scales, we are going to see the bleeding. So it is highly vascular. Terminal edge, third part, terminal edge, so sharply demarcated border between the lesion and surrounding healthy skin. So this is the triad of the psoriasis. You have to remember it a bit. Let's say the first question. So the first question says itself, the steering spot, terminal film and blood dew. Blood dew means there is bleeding when they removed it. Terminal film means with the clear borders, and steering spots simply means that easy peeling of the skin. So we termed it as psoriasis. And this is the direct question from the KROK, so remember about it. Next question says about the plaques covered with the white scales. You can read the question by pausing the video. Aggravation mainly in the spring, so since it is a seasonal thing, so aggravation in the spring. So we got what we needed those silvery or let's say white scales. So white scales are there in the question, and all of the profile is related to the psoriasis, so remember about it. Next question says about silvery scales as well, so you will remember the psoriasis very well now. Next question also says the triad of the psoriasis, steering spot, terminal film and punctate hemorrhages, so also about psoriasis. Next is saying about the silvery scales. So everywhere these silvery scales will be there, pink papules on skin of torso, scalp, so everywhere they are going to be the silvery scales, so mark the psoriasis. In this case they said it disseminated psoriasis. And in this question, this is the last question, also they have said about the silvery scales, so you will remember now. Let's read the definition one more time. So it's a autoimmune condition which will cause rapid cell turnover, leading to scaling, inflammation and red patches and skin covered with the thick scaly white scale, the silvery scales. So common in the areas of scalp, elbows, knees and the lower back. So one more thing is there, if you want to see, I have written something here. So psoriasis as a complication will lead to psoriatic arthritis in future, which can be treated by NSAIDs or DMARDs. You know about DMARDs, right? In rheumatoid arthritis we are using methotrexate. If you haven't watched my video over rheumatoid arthritis and osteoarthritis, most welcome to watch. It is a short video. Let's go next. So next is eczema. So about eczema, we all know that it's chronic inflammatory skin condition characterized by dry, itchy and inflamed skin. So itching is very common in this case, and let's see the symptoms of it. So dry sensitive skin, itching, severe at night, red or brownish gray patch will be there. Or in the KROK question it says some sort of vesicles, oozing lesions or some things like this. It highlights in the KROK question. So let's see about microbial and eczema and allergic dermatitis a bit. So microbial eczema involves the secondary infection or description of pus. So there will be always a history will be given in the question. that there is this and this in the background, sometimes the tropic ulcer, sometimes about the patient is having burn, and in the background of burn and this pathologies, the patient developed the vesicles, erosions, and this all the things. So we are going to see such type of questions. So let's highlight the questions now. Also, the allergic dermatitis will be when there is any contact with the allergen. So let's see the first question. The first question says a strong nervous stress. So we remember from this question now that eczema is also triggered by the nervous stress. So emotionally staining situation will also trigger the eczema. So that resulted in the formation of red and edematic areas on the back surface of the hands, and further formation of small inflamed nodules, vesicles, erosion, discharge of serous liquid, and itching. So this is the common eczema. This is the profile of common eczema. Common eczema you say, or directly eczema it says, or atopic dermatitis you say. So all the things are similar. And just remember about vesicles, erosions, nervous stress. So these, and itching very, very severe. So these are the things which will cause eczema. Next is the case of microbial eczema. As I have told you, in the background something will be given, as we remember from the definition part, that in the background something will be given. So here what it says, itch in the left shin and especially around the tropic ulcers. So the patient is having the tropic ulcers in the background, and the skin, it says that red and edematic, some oozing lesion he got in the background of tropic ulcer. He got some oozing lesions and single yellowish crust, and on the focus of affection, well defined area. So it's secondary and infection. So secondary, it's a microbial eczema, that in the background of something. The background here is tropical ulcer. In the next question, true eczema. So true eczema, common eczema, they are similar things. However, both of the things will not be given in the option together. So a nervous stress will cause eczema. So after the nervous stress, the patient developed the redness, swelling, which is replaced by the small inflammatory nodules, vesicles, erosion. The same thing in all the questions, with the significant serous discharge followed by severe itching. So this is a common profile for the eczema. So let's see the next question, question number 4. So there is a welder who is having first degree burns on the right shin, and later developed on the background well-defined erythema and polymorphic rash and papules, vesicle, pustules, erosions. So you remember from the definition of microbial eczema, this is the same case, that the patient is having first degree burns and in the background of burns the patient developed this and these vesicles, erosions. So this is the case of microbial eczema. Next, let's read the definition first. In the top corner, occupational eczema. So occupational eczema is involves specific antigen for the long time of years. So it is related to the work, like during working the patient is exposed to some antigen or allergens. So it occurs during working. So let's see the question. The patient is a painter. Question number 5. Painter, 14 years contact with the synthetic paint. Pain results in the face, skin redness, swelling, intense oozing lesions. Symptoms disappears after the exposure to the chemical agents, but reoccur even with the smell of the paint. So as we see that the patient is severely allergic to the paint, even the smell of the paint right now. So he's a painter, and he is having occupation as painter. So we are going to mark as occupational eczema, or let's say professional eczema. Professional, which means profession. So the profession is painter here and occupation is painter here. So we are going to mark the occupational eczema or professional eczema for this. Next is also the case of occupational eczema. On the 28-year-old patient has skin rash, itching, occupational contact with the formaldehyde resins. So and lesion foci symmetrically localized on both hands against the background of erythema with blurred margins, and there are papules, vesicles, erosion, crust, scales. So remember that the scales which are given in the question this time are not the silvery scales. If it would be psoriasis, it will say white scales or silvery scales for sure. So these scales are related to the eczema, and since the patient is The patient is having occupational contact with the formaldehyde lesion, so it is related to his occupation, so we are going to mark the occupational eczema for this question. Next is again the occupational eczema. Milker is there, some milker, so he got rash on hands, and he rash, weeping, itching, expanding on this on the her skin. Examination of hands shows nail plates to be yellow, brittle. Presentation aggravates during work, so he got some allergy or itching, let's say, while working as a milker. So this is the case of occupational eczema. I hope the eczema is clear now. If there is something, let me know in the comments. Let's go next. Erysipelas. So remember, erysipelas is a bacterial infection caused by Streptococcus A of the upper layers of the skin and lymphatic nodes. So red, raised, defined rash. Let's see the symptoms. Bright red swollen rash with clear borders. If you just remember the clear borders, you are going to solve the KROK questions very easily. So clear borders are seen in the infection Streptococcus A erysipelas. So there will be pain, blisters, vesicles, lymphadenopathy, since it is bacterial infection, fever and chills, high temperatures. So let's see the first question. The first question says the 43-year-old female, eruption of the right leg skin, pain, weakness, body temperature 38, disease is acute, edema of the right leg shin and region of the foot, a well-defined bright red spots. Well-defined means what? Clear borders, right? I have highlighted it very well here, that well-defined. So well-defined, as you can see in the question, well-defined bright red spot in the form of flame tips which feels hot, and isolated vesicles in the focus. So it is the case of erysipelas. You can see the well-defined also means clear borders. And also remember one thing, according to the KROK question, the erysipelas is more common in the legs, and the phlegmon of the newborn is more common in the lumbar area. So if you remember here that erysipelas have clear borders, so remember that gout have unclear borders, or let's say without clear borders, right? So just a thing to remember. However, I'll explain in the next portion. Let's see what the next question says. The man complains of skin redness, pain in the right calf. So as I've told you, it's erysipelas is common in legs. Fever is 35 and large painful inguinal lymph nodes on the right. Skin is affected with edematous hyperemic skin rash and vesicles filled with the dark liquid, and its palpation is painful. There is a clear margin. You got what you needed, right? So mark erysipelas hemorrhagic form because there are hemorrhages. So you are going to find the answer anyhow. So let's see the next thing is Parkinson's disease. So I will not talk a lot about Parkinson's disease because there is only one question over it. So Parkinson's disease is simply the degeneration of the dopamine producing neurons, and the symptoms will be, the main symptom is bradykinesia. So the patient will be slower, as you can make my video slower this time. So the patient will be slower, he will walk slow, he will talk slow. So tremor of hand, tremor in one hand, rigidity, stiff limbs or trunk, postural instability. So let's see, the main symptoms are mood disorder, because this is the problem with the dopamine. So the question can highlight that the mood of the patient is not good, or mood swings are there. I've seen some question in the test center in which they are giving the mood swings. So they are simply requiring dopamine, you know that. So this is let's see the case study. The case says the 72-year-old patient have hand tremors, stiffness, slowness of walking, which is bradykinesia, right? The patient is walking slow. And speech difficulties in performing routine household chores, because the patient is feeling very slow, that's why he's having these and these problems. Bradykinesia, okay, the question highlights now. The hypomimia is simply means the lack of facial expressions. Next is shuffling gait, hand tremors at the rest, anisocoria, cogwheel rigidity, plastic type. So simply we know that by saying bradykinesia itself, we are almost sure that it's gonna be the Parkinson's disease. So the patient is lacking dopamine. So what medicine you are giving to the patient this time? So medicine which the patient requires right now is levodopa. Here all right. So levodopa is something which will stimulate the release of dopamine. So this is Parkinson's disease. So if you have watched my last video over the investigation methods in KROK, so I highlighted the which test they are using in phenylketonuria. That's a ferric chloride test, which is an old treatment, but still according to KROK it is the ferric chloride test. So I've told this question in that portion, but let's hear it here as in the written form as well, that phenylketonuria is a genetic disorder characterized by the body's inability to metabolize the phenylalanine. So the symptoms we are going to see is the patient cannot process the or digest the phenylalanine product. So symptoms we are going to see is developmental delay, seizures, behavioral issue, eczema, and musty odors. This musty odors is highlighted in all the questions of KROK, that musty odor is there, so you can diagnose easily phenylketonuria. However, how they are treating this 2-week-old baby? They are treating this 2-week-old baby with the special diet, because no medications are required in 2-week-old baby, and we can just change the diet which will not contain the phenylalanine. So that will be enough to cure the phenylketonuria. Next is gout. So let's talk about the gout. Gout is so simply a type of inflammatory arthritis caused by the deposition of uric crystals in the joints. So let's hear some symptoms. A lot of symptoms are there. Sudden severe joint pain is there, swelling is there, redness is there, warmth, tenderness, limited range of motion, because it is related to the uric acid crystals when got deposit into the joint. So it will cause the limited range of motion for the joint. And this is the main highlighted part here, the toffee. Toffee is something, the visible crystals under the skin for the uric acid. And kidney stones can be there, since the problem is with the uric acids, frequent gouty attacks, and kidney stone. One more thing I have given here. Prescribe. This is the question for the KROK. They three of them are the question for the KROK in the top corner of the gout. That there was some question that this and this and gout is there. So what to prescribe to these patients? Dairy products should be provided to the patient. So gout. So to the patient of gout, what you are going to provide? Goat milk. Simply, you can remember that dairy products will be useful for the patient with the gout. So when the question or examiner is asking about the treatment, normally treatment of the gout, so it will be colchicine. But when the examiner is asking about the urate lowering agent, so that's gonna be allopurinol. So remember about this thing. Do not mark the incorrect answer. Let's see the profile of gout, how it is. So the 62-year-old man, moderate pain in the left foot in the area of his metatarsophaphalangeal joint. So this is more common in the joints, as we know. This is the problem with the joints. So acute pain attack, and 2 years ago a yellow white nodule. So this time the question is highlighting about the toffee which we just saw here. So they are visible crystals under the skin. So yellow white nodules are most probably related to the gout. And skin that covers the joint, deformed, cyanotic, narrowing of the joint space, since it is a problem with the joint, and well defined bone tissue defects, and epiphysis, punched out erosion. So these punched out erosions, everything is like a hallmark you have got for marking the gouty arthritis. So yellow white nodule, or let's say toffee. Next is the 30-year-old patient complains about the reddening of the skin, in edema in the ankle joint area. Fever is 39. Sudden illness in the past. Similar attacks lasting 5 to 6 days without residual changes in the joint. So skin over the joint is hyperemic without defined borders. Just remember about it, guys. The question doesn't really say anything highlighting or anything hallmark about gout. So just so you know, and don't mark the question incorrect, I just want to highlight it this much, that that erysipelas is with clear borders and gout is without clear borders, or let's say the question says ill-defined borders. So just remember it right here. You are going to solve a lot of questions using this technique. So remember about these indefinite, the joint profile or sudden illness, the profile with the without defined borders. So the gout is with the without clear borders. Let's go next patient. Next patient is a 47-year-old obese man, periodical attacks of acute arthritis in the tarsopharyngeal joint. So more commonly the gout occurs in the foot of the patient. So that's why the question is highlighting tarsopharyngeal or metatarsopharyngeal. Lab examination are important in this question. So as we know that a lab examination says the serum rate of uric acid is increased. So if uric acid is increased and the problem with the tarsopharyngeal joint and the attack of acute arthritis, so we know in the leg it will be gout for sure. Let's go next. The next question also says about the metatarsopharyngeal joint, and which is hot to touch, and the uric acids are again important here, because we know that gout is the problem with the uric acid crystals in joint. The uric acid starts to deposit in the joints, that's why it's problematic. And punch out erosions, which you have seen in previous questions as well. So remember to mark gout about this question. You can pause the video and read the question once again, no problem at all. Let's go next. Next is gouty diathesis. So only one question about gouty diathesis. So let's see what it is. It is a neuroarthritic diathesis. So metabolic predisposition in which the body has difficulty in metabolizing the uric acid. So similar profile to gout, right? So main thing is symptoms here. You if you remember the symptom, you are going to mark the gouty diathesis correct way. So nightmares, sleep disturbance, bedwetting, anxiety and restlessness, advanced intellectual development, these are the symptoms related to the gouty diathesis. Let's hear to the question. Let's hear to the patient. Patient is a girl, 5-year-old child. She is having involuntary urination at night. So we got bedwetting is written here, yeah. So it's a symptom of gouty diathesis, yeah. So she is wetting the bed, she is having nightmares, sleep disorders, slow gaining weight of the body, malnutrition, intellectual development is good. That we have seen in the patient that instead of the reduction of the intellectual development, or let's say the memory problem, or the intellectual development, so there is advanced intellectual development in such patients. So they say in the question that the intellectual development is very good in the patient. So this is mother suffers from cholelithiasis, so maybe some history. So a type of diathesis is gouty diathesis. So remember, when the patient is bedwetting at night and having nightmares, and very intelligent person when wetting bed at night, so this is the main feature highlighting the gouty diathesis. So this is it with this video, and let me know in the comments if you are still marking some question incorrect. I'll let you know well explained in the comment box, and wait for the next video. See you in the next video. Have a nice day.